As a Queen's Young Leaders alumni, we have the opportunity to start a Queen's Young Leaders Legacy Network project, which is focused on empowering young people to talk about health matters, especially health matters towards young women, SRH issues, HIV and AIDS, maternal health, teenage pregnancy issues. As Sub-Saharan Africa highly does not have access to SRH services, we are here to prove that we can empower other young people to be able to access such services and also advance in their communities to transform change.
Hello everyone. This is Christine Gatti Alphonse, and I'm a Queen's Young Leader from Kenya. I'm privileged to be in this program because of the work that we're doing in Korea, that is girl child empowerment and also advocating against FGM. We're here to empower each and every young person to know their rights, and specifically on sexual reproductive health. So everyone is involved, everyone is invited. So stay tuned and learn more about sexual reproductive health from our project, My Health, My Value. And all of us are Queen's Young Leaders, and we're integrating more other leaders who are out there. Welcome.
Hi, my name is Walter. I'm from Uganda. I'm an anti-FGM activist, and I also advocate against child marriage and teenage pregnancy. I've done this both locally and globally, in at least around the continent. Yeah, I think being here about the launch, I think it is time for us, to champion SRH. I'll give an example. Kenya is the powerhouse of East Africa. If you want to do a continental or a regional campaign, it has to be in Kenya. It has to start in Kenya, because today, if we look at the level of education of women in East Africa, is not right now so high, though we are empowering them and young people. I think we need to get away from empowerment to investment. I think that's one thing I call upon all of us young people. You need to join this network. I am not a Queen's Young Leader, but I came here to join the network to see how we can partner and work together, because it is so relevant, all young people, to work together to champion any kind of women, young people, women and youth empowerment in our societies. About the launch is it is like a movement. It is like an opportunity for us to get together to look at something that we can work on together beyond the border, because today everyone, a lot of young people, we fear to work alone, but I think this is like an opportunity for us to work beyond the border, because from Nairobi to Kampala is very near. The same thing from Kampala to Kigali or to Dar es Salaam. It's very near, but if we can work beyond the border, we can champion a lot of things. And I think this is a great opportunity for the whole of East Africa to work together and see how we can champion sexual reproductive rights to everyone, and how can these services reach people in rural areas, because today rural areas don't have access to information, they don't have access to all these things. If you look at the whole of East Africa, we have a lot of NGOs, and these NGOs, not everyone that works in rural areas, they fear to go there. But I think this is an opportunity for us to go where others don't go and to reach that grassroots level. I think we need also to really focus on a grassroots-based approach. How can we get to rural areas? How can we really empower communities? How can we empower people, those who are not going to school? Because NGOs target only people who have gone to school. But I think this is an opportunity for us to also look at those people who cannot be reached out to.
My name is Ruth Ambogo, and I was a guest of honor at the Queen's Young Leaders Network launch of My Health, My Value project here at YWCA Nairobi. And basically this My Health, My Value program is a program that has been started by the alumni of Queen's Young Leaders Network to be able to address issues around sexual reproductive health rights, access to contraceptives, HIV and AIDS, teenage pregnancies. So my message today was that there needs to be a concerted effort of different facets of the society, that is the youth, the government, stakeholders, and young people need to come together and keep their government accountable, start programs in partnership with organizations that will go towards solving some of these problems, that will go towards ensuring that there's access to contraceptives, that will go towards petitioning the government to come up with laws that are favorable to the sexual reproductive health rights within their various countries. So I basically reminded these young people, and myself included, that together as young people there's so much that we can do. We have the power of social media, we have the power of connectivity amongst ourselves, we have the power of ideas, and we have the creativity of the youth and the energy to be able to do this. So I applaud the Queen's Young Leaders Network for this amazing program that shall deliver milestones in solving the issue of sexual reproductive health rights.
My name is Kenya Josephine. I'm from Uganda, a Queen's Young Leader in 2016. I just launched a project for the alumni of Queen's Young Leaders, and it's called My Health, My Value. It's going to mainly concentrate on sexual reproductive health. And as a Queen's Young Leader from Uganda 2016, I've been working on the sexual reproductive health component in my work in Uganda. That is at Muju, Macquarie University, John Hopkins Research Collaboration. And mainly what we've been doing is to provide voucher cards to Young Generation Alive members to be able to access these services at a free cost, as we provide the information freely at Muju. Therefore, with this project, with this grant, I'm going to expand on my work on providing sexual reproductive health information, both in schools but also in communities. And I'm going to furthermore go on to connect with different youth-friendly service centers to be able to provide these services at a free cost to all adolescents, to all young people that I'm going to be interacting with during the school outreaches and the community outreaches. Thank you very much.